It has been estimated that during a lifetime, about 75% of all women are likely to have at least one vaginal yeast infection, and up to 45% have two or more. Business Gladys here today, people, and welcome back to a next to follow. Today we are diving into the world of vaginal yeast infections. Stay tuned. First off, vaginal yeast infections are not STDs. They are not sexually transmitted diseases. Normally, we all have our natural yeast in our bodies. Now, vaginal yeast infections happen when the natural yeast in our bodies start to overgrow, when they start to party a little too much. That's what causes us to have vaginal yeast infections. So, if you've ever had one, know that you're not alone. Okay? Now, how do you get to know that you've got a vaginal yeast infection? It's easy. Trust me, it's easy. One of the most common symptoms is itching and irritation, often intense in the vagina and vulva. Some women may experience burning sensation during urination or may have painful intercourse, and some may also produce a discharge, a clumpy discharge that resembles cottage cheese, and the labia may also appear swollen and red for some women. So these are some warning signs of a vaginal yeast infection, but you must make sure to confirm your diagnosis with a physician before picking up any treatment measures. Now, let's talk about what you can or cannot do when you have a vaginal yeast infection, and of course, how to prevent it. Staying in wet clothes is a big no, no, no. If you're wet for some reason, for instance, after a swim or an intensive exercise session, changing out of wet clothing quickly is vital, because damp environments can encourage yeast growth. It's like you rolling out the red carpet for yeast overgrowth, so that's a bad practice. Another tip is to avoid scratching the itchy area. I know, right? It's easier said than done, but please avoid scratching because it makes your symptoms worse. If you've had a yeast infection before, you understand what I'm talking about. The itching, I know you can literally sell out your birthright just to have a scratch. I understand the urge is always very intense, but avoid scratching. So avoid scratching, and try these tricks instead. You can try applying something cold, like a cold pack, to the itchy area or wherever you feel uncomfortable to get some relief. And another way you can prevent a yeast friendly environment is to steer clear of very tight clothing. I strongly recommend cotton panties to nylon or non breathable panties. Okay, cotton panties are the best. And if you are a pant liner person, make sure you change them whenever they feel wet. I'll recommend after every pee session you change your pant liners, and that's a good way to prevent your natural yeast from overgrowing. Okay, and also there's a common misconception that more showers are better, more showers will prevent infections. No, that's just a misconception. If you over cleanse yourself, especially when you start using all these medicated products down there, you are tampering with your natural vaginal pH, your natural vaginal acidity, and that can rather expose you to infections than prevent you from having infections. So showering once a day is perfect, just fine. And please be gentle with your products. No harsh products down there. Now, the big question, can you make love when you have a vaginal yeast infection? My darling sister, it all depends on your level of comfort. Okay? It's totally fine. Remember, I said it's not an STD. It's totally fine. It depends how comfortable you feel about it. But if you were to ask my opinion, I would say that making love when you have all those symptoms, itchy, swollen, red labia, is going to be painful, and it might, depending on how critical your situation is, it might worsen your symptoms. Okay. But again, like I said, it depends on how comfortable you feel about it. Now, regarding treatment, there are loads of options out there, from over the counter medications to prescriptions from your physician. There are so many, but the key is to complete the course of your treatment, because there's often that temptation that once you've started your treatment and you start feeling better, after taking your antibiotics for the first few days, you may start feeling better and become symptoms free, and you think you're fine. It's going to reoccur, and that's one challenge most women are facing. Their yeast infections keep reoccurring because they do not complete their entire regimen, antibiotic treatment. Okay, so once you've started, make sure you complete it according to the doctor's prescription. That's a wrap up on today's topic, people. Remember, knowledge is your best friend. If you have any questions, please drop them in the comment section below, and don't forget to like, share, and subscribe to us to follow for more health tips. And until next time, stay informed, take care of yourselves, people, and I'll see you in my next video. Ciao.